I'm not going to go into the different kinds of granules because there's a whole bunch of different kinds of granules and specific names for them. I'm not going to do that. Basically, what we're going to do is we're going to say that there's granules, and these granules, whenever this von Willebrand factor activates this platelet, the granules start to become stimulated. They undergo degranulation. And when they undergo degranulation, they release three chemicals. One is adenosine diphosphate. What the frick is adenosine diphosphate? What's important about it? We'll talk about that. What's the next one? He releases another chemical called serotonin, which is a biogenic amine. And he releases another one called, let's draw these bigger so you can see them. One of these is called adenosine diphosphate. I'm not going to write the whole name. You guys should know how to spell it. Adenosine diphosphate. The other one is serotonin. And the other one is called thromboxane A2. Okay, let's explain these chemicals. Okay, so far we've known injured endothelial cells release von Willebrand's factor. Von Willebrand's factor binds onto the collagen fibers, forms a cross-bridge formation between the collagen fibers and now the aggregating platelets. The platelets begin to adhere to the von Willebrand collagen complex. The receptors on the platelets are activated by the proteins. The proteins then, when they activate the receptor, there's receptors and chemical intracellular signals that activate granules. The granules begin to degranulate and release three potent chemical messengers: adenosine diphosphate, serotonin, and thromboxane A2. Now we just got to figure out what the frick do these chemicals do. Well, adenosine diphosphate is a potent aggregating agent. What does that mean? All these big words. It's a potent aggregating agent. Basically, to make it simple as possible, it acts as a chemical, or I could say, let me say it like this, a chemotactic agent. Let's say it like that. It sounds pretty good. What it does is it attracts in other platelets that are circulating through this plasma of where the blood vessel injury is occurring. So those chemicals, ADP, serotonin, thromboxane A2, start causing platelets to adhere to the site of injury where the blood vessel was ruptured or damaged or underwent severe trauma. Okay? When it does that, ADP just causes them to adhere, but not only does ADP cause the platelets to adhere, but it'll then cause the platelets to be able to release their contents. Because why? Because now another platelet will start rushing here. His receptors will get activated. Another platelet, 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 another platelet. And they just keep going and releasing their contents, ADP, serotonin, thromboxane A2, until these platelets begin to form a nice, big plug. So basically that's what ADP does. ADP is a potent aggregating agent. It just causes the platelets to aggregate, adhere to the site of tissue injury or blood vessel injury, and then it causes them to release their contents. Those contents aggregate more platelets to that area, pull more platelets to that area, release their contents, and it's a continuous cycle until a nice big fat plug's been formed. Okay, what does serotonin do? Serotonin does this, but we also said that serotonin also stimulates the smooth muscle cells. We said that serotonin also stimulates the smooth muscle cells. Okay? You know that it stimulates the smooth muscle cells. How? Because serotonin binds onto the receptors. 5-HT receptors, sometimes just serotonin receptors. And then initiates calcium entry. Calcium helps to initiate contraction. Okay? Shortening of the muscle. And then thromboxane A2 helps as an aggregating agent. Serotonin, cancel that. Serotonin mainly helps with vascular spasm. Serotonin mainly helps with vascular spasm. Thromboxane A2 can help vascular spasm and aggregation. Serotonin is mainly vascular spasm. Adenosine diphosphate is going to trigger an aggregation, which is just pulling more platelets to the site of tissue injury, causing the plug release their contents, and then continue that process. And thromboxane A2 does vascular spasm and aggregation. Now, once all this has occurred, we have to have something else happen. You know, platelets, if they just come into this area and they're just all globbing together, you know, they're not really going to stay there. You know, sometimes if you just have one just come in and bind onto the receptor, it could end up leaving. You don't want that. So another thing that von Willebrand factor does, not only does he cause the activation of these receptors and then degranulation, but he does another thing. He does 3 S's, and it's not what you think it is. He doesn't sugar, honey, iced tea, shave, and shower. He does something else. He causes the platelets to do 3 things. What does he cause them to do? He causes them to, let's erase this. He causes the platelets to do something very, very important. Okay? He causes the platelets to be able to get these platelets to not only perform all these mechanisms, but he wants them to stay in that area to form a nice plug. So he does 3 things. Von Willebrand's factor. Von Willebrand's factor does 3 things. What does it do? It makes the platelets sticky. Okay? Adhesive mechanisms. So it causes the platelets to stick to one another. So it causes the platelets to become sticky. Okay? Platelets start sticking to one another. It also causes the platelets to swell up, to pick up. Why? Why would you want it to swell? Well, the more you cause it to swell, the more it's going to be able to pick up that surface area, and the more they swell, less platelets will have to adhere to that site, but that's going to inhibit any kinds of blood from escaping. So it swells up to increase that surface area of the clot. Not only that, but it causes them to form spiked processes. Spiked processes. So it does 3 things. Von Willebrand's factor causes the platelets to become sticky to one another. It causes them to swell up, and it causes them to form spike processes. And it activates the receptors, which then activate the granules and then release adenosine diphosphate, serotonin, and thromboxane A2. You know this about it. Okay, so that's basically the part of platelet plug formations. Now, let's see if we can go back and remember everything from vascular spasm to platelet plug formation really quick, and then we're going to do one more video, and this video is probably going to consume a lot of time because it's usually the hardest one. And it just takes repetition. That's the key thing within this next one. The next video is going to take repetition. Okay. So let's just make sure that before we move on to this next video that you understand everything. Again, we're not going to draw anymore, but let's just make sure that you remember everything. Hemostasis. Hemostasis is going to be blood stoppage. Fast localized event occurs in 3 phases. First one, vascular spasm. Second one, platelet plug formation. Third one, coagulation. Vascular spasm is what? The first event that occurs whenever a blood vessel is injured in any way. Okay, ruptured, damaged, hemorrhage, whatever. And it's going to cause the immediate vasoconstriction of the circularly arranged smooth muscle within the blood vessel wall that was injured. Simple. 3 things. Chemicals. Just break it down to 3 things. Chemicals, pain receptor activation, and myogenic mechanism. We already talked about all that. You should have that down by now. Then after that, I told you that what's the whole purpose of performing vascular spasm? To decrease the volume of the affected vessel, to make sure that not a lot of blood is escaping out into the actual surrounding tissues, causing severe hematomas. Okay? That's basically it. And then I made a comment in a couple of the videos that vascular spasm is that we say that the amount of vascular spasm occurs, the amount of vascular spasm that occurs is directly proportional to the amount of tissue damage that occurs. The larger the tissue damage, the more powerful the vascular spasm. But I said that mainly it's the small blood vessels within the body that are usually throughout the day undergoing the most damage upon the environment. We talked about platelet plug formation. Platelet plug formation is going to be subsequent events in which platelets orchestrate a clot formation. They temporarily seal off the break in the vessel wall. How does it happen? Well, platelets are no longer kept inactivated because the healthy endothelial cells can't release prostacyclin. They can't release nitric oxide. They can't release adenosine diphosphatase. So then what happens? Platelets start to adhere to the collagen fibers. But as they do that, the injured endothelial cells release a large plasma protein called von Willebrand's factor. Von Willebrand's factor binds onto the collagen fibers, forms a cross-bridge formation between the collagen fibers and now the aggregating platelets. The platelets bind onto the von Willebrand's factor. Von Willebrand's factor is 2 things if we want to think about it. One of it is the proteins activate the receptors and then cause the granules to become degranulated, release 3 chemical messengers, ADP, serotonin, and thromboxane A2. You know their functions, we talked about it. We're just kind of really quickly overviewing it, so we can go into the next video. And then we said that von Willebrand's factor, not only does it do that, but it also causes the activation of the platelets to form spiked 3 S's. Not sugar honey iced tea, and not shaving, and not showering, not that stuff. It's going to be 3 S's. It forms spiked processes, okay? It swells, and it helps to be able to become sticky. Okay, all those things help to be able to make that platelet plug nice, okay, nice and tough, okay? Now, once it does that, we're going to go into the next video. But basically what I want you guys to start thinking about is now that it's formed this plug, and it started releasing all these different kinds of chemicals. I'm going to go into this in the next video, but we're going to go coagulation. Coagulation is just basically blood clotting. It's turning blood from a liquid, which is its normal form, into a gel. But I want you guys to start thinking about this. These platelets on their external surface membrane have negative charges. And that negative charges is due to a chemical. You probably don't need to know this, but it's called phosphatidylserine. I like to say that word. It's probably a title. Serine. It's a negatively charged phospholipid. It's actually negatively charged phospholipid, but this is serine is an amino acid. It actually looks like this. Serine is H carboxyl end, your amine end, and then the serine is just CH2OH. It's a hydrophilic amino acid. And so basically it's polar, but basically this is a phospholipid, but serine's a part of it as well. But basically that negatively charged phospholipid with a kind of an amino acid complex helps to be able to activate proteins. And we're going to talk about those, because that's going to be the main topic of the next video. Okay? Hope you look at my next video. It's going to be on coagulation.